Hi, Strong Mom Society. So I put this next series together for some of my clients that have experienced rib cage pain during pregnancy. So if this is you, try these exercises as many times a day as you need to. There are a few reasons that this could be happening, that you're feeling a little bit of uncomfortable pressure or discomfort in the ribs, pain even. It could be the belly expanding, and the ribs have those intercostal muscles that are stretching and expanding as the rib cage is opening. It could be the position of the baby. It could be where the baby's feet or head or arms are pushing up into the ribs. It could just be everything getting bigger and you just not feeling great as your body is stretching and growing. Whatever it is, we want to make sure that you're getting the diaphragm on and using it to its full capacity. So whether you are in the early stages of pregnancy or in that third trimester when it's really hard to take a nice deep diaphragmatic breath, using that diaphragm is really important because, as you know, it is the top of your core. And if that diaphragm isn't working properly, then the rest of the muscles are not going to be able to respond in the best way possible. So we want to protect that core, we want to protect that pelvic floor, keep that pressure neutral, and really set you up for a easier pregnancy and complete postpartum recovery. So the first thing that we're going to do is just take some seated breathing exercises here. And I want you to just sit in any position that feels comfortable. You can prop yourself up on some blocks, some pillows, close your eyes, and if it helps, go ahead and bring your hands to the bottom of your ribs. And I want you to start to breathe in a way that pushes your hands out to the sides of the room. So think of those bottom two ribs. You can even give yourself a little bit of compression on the exhale, so you're squeezing your ribs together. And then as you inhale, try to over-exaggerate that expansion at the bottom of the rib cage. You can fill your lungs with air too. You can do an upper chest breath if that helps. But I want you to really push those ribs out to the sides, and then exhale, bring them back together again. Take that 2 more times. We're gonna press on the exhale. Inhale, push those ribs out to the sides of the room. Exhale, bring them a little closer, and then inhale, pushing them out, and exhale. Great. I want you to take the same breath on your back. So you're gonna lay down supine. Bring your hands to the front of the ribs this time, and as you inhale, try to push your hands on the bottom of the ribs up to the ceiling. And then exhale, lower. Inhale up. Exhale, ribs get really heavy. You can even feel the front of the ribs kind of soften and sink down into the ground. Inhale up, exhale, lower. This time as you breathe in, I want you to press your ribs into the floor behind you. So inhale, exhale, inhale, press down into the floor, exhale. Last one, inhale, and exhale. We're gonna roll over to your right side. Go ahead and just take either your right hand to the top of your ribs or the left hand. You can tuck that other hand underneath. As you breathe in, you're gonna take your left ribs up to the ceiling. Inhale, lift. Exhale, lower. 2 more times. Inhale up. Exhale down. And last one. Inhale up. And exhale down. You're gonna lift yourself up, flip over to the other side. So coming down, bringing a hand to the right side of your rib cage this time. Inhale, lift those ribs up to the ceiling. Exhale down. Inhale up. Exhale down. 2 more times here. Inhale up. Exhale down. Inhale up. And exhale down. Good. We're gonna come all the way up to standing. So take your time, find your hinge, find your glutes, use that exhale to bring yourself up. I want you to Take this breath here. So fingertips are at the front, your thumbs are at the back. As you inhale, think of expanding your ribs 360 degrees. Inhale. Exhale, you're gonna feel that rib cage get smaller. Inhale. And exhale. Good. Take your right hand to the left side of your rib cage. Take a little bit of a wider stance. And I want you to inhale as we take a side bend away from your hand. So imagine those intercostal muscles, those muscles that run in between each of the ribs. And as you bend, you feel how the ribs separate. And we're gonna try to inhale air and feel some expansion into the sides of the ribs. And then exhale like an accordion. Bring everything back to center. Inhale, expand. Side bend, exhale. Inhale. Exhale. Inhale. And we're gonna stay on that same side with your opposite hand. You're just gonna take a little rotation through the back of the spine. Inhale, exhale, inhale. And you can kind of distort the body there, really pull through the shoulder as you take that reach. We're trying to get air into all of those ribs in case they're holding tension. Let's go to the other side. Hand on the side of the rib cage. You're gonna take a big breath in. Feel how those ribs separate, those muscles also lengthen. And then exhale, bring yourself back to center. Inhale, press or bend. Exhale, upright again. Inhale, feel those ribs separate. Back to center. Inhale. And then with that opposite hand, I want you to go through that rotation. I really feel like I'm trying to separate my shoulder blade off of my back there. Breathe in and breathe out. And last one. Good. And if you ever took a jazz class growing up, you may remember rib cage isolations. So I want you to imagine that your pelvis is really stable. Your shoulders are kind of stable too. And you're just gonna shift your ribs. If you could move your ribs, or if you were like a paper doll, you're just gonna displace the center, from the abdomen up to the bottom of the ribs, to the right and to the left. We're just mobilizing here. And then I want you to take those ribs and I want you to jet them forward and jet them back. So you're gonna pop your ribs open and then sink your ribs through your spine. Good, and then we're gonna take a full clock. We're gonna go front, side, back, side, front, side, back, side, and then go the other direction. You're just taking a big circle here around. Keep breathing into it. Good, and then shake everything out. And I want you to bring yourself all the way down to all fours. Last exercise here. And you're just gonna go through a gentle cat and cow. So inhale, take your eyeballs to the ceiling, press, give yourself a little bit of scapular activation. And then as you exhale, round through the spine, tuck your chin to your chest. Really try to poke through the center of your shoulder blades. Inhale, find some scapular activation. Maybe hug the belly towards you a little bit. And then exhale, round. Take that 2 more times. Inhale up and exhale, round. Last one. Inhale up and exhale, round. Great. So try these exercises when you get up in the morning, try them midday if you've got some of that rib cage pain. Definitely do them before you go to bed at night, and report back. Shoot me an email, let me know how you're feeling and if you feel like this works, and also let me know what you need. I am always happy to film more content. I'll see you guys soon.